Welcome everyone to our webinar this morning. We'll go ahead and get started now. Seems like we've got everybody signed on. This morning our presenters are going to be Carrie Emhoff and Scott Wiener from CommuniCare facility. They're going to go through this presentation. Before that, I'd like to give a brief overview of our AlterG products. Carrie, if you could go to the next slide. So those of you who are joining us are most likely familiar with our Anti-Gravity Treadmill. This is sorry, one second. So we have on here our anti-gravity treadmill and our bionic leg. Our anti-gravity treadmill uses differential air pressure technology to unweight patients down to 20% of their body weight. This can be done in 1% increments to accurately unweight them. The users will wear a special pair of neoprene shorts that zip into our cockpit, which create a comfortable fit in a fall-safe environment. A variety of exercises can be done with patients, some of which will be reviewed in the webinar today. Our other product is the AlterG Bionic Leg. This is a robotic assistive device that is activated by the user's intent to move. This is to be worn over the user's affected limb, and it helps patients perform more repetitions of functional exercises. This helps increase confidence and achieve higher levels of mobility and function. If you want any more information about either of our products, feel free to email us at marketing@alterg.com. I'd like to hand it over to Carrie and Scott now. Carrie and Scott, go ahead. And as a reminder to everyone, throughout the duration of our presentation, if you have any questions, you can type it into our chat box. We'll have time for a Q&A session at the end.
Okay, guys. First, I want to talk a little bit about why we ended up getting the AlterG here at this facility in the first place. We were actually just remodeling everything in the building. We opened up a brand new treatment gym, and to go along with it, we wanted something that really kind of made us stand out a little bit from the crowd, gave us an opportunity to broaden our treatment options a little bit, give us something that can really help us to give our patients an edge to get them better, which is what we all want to do. That's our main goal, but we can't do any of that unless we are really getting steady referrals from physicians. So that was one of our goals with the AlterG, and we've had good success with it so far. I personally have gone out and talked to some doctors at times. Carrie, who's about to talk here in a second, is our liaison here at CommuniCare, and she is the one that's doing most of the marketing. So I'm going to turn it over to her now and let her share some of the success we've had, help you guys come up with some treatment ideas, and I might butt in from time to time if I have anything I want to add to it. And then I'll come back to you guys in a little bit.
Hello, everyone. Well, first of all, when I first started here, I didn't really know much about the AlterG, and we have our own rep, which is Shannon, and I'm sure that you guys that have the AlterG have a rep that you can contact, but she has been amazing. She has came in, she's done training with our marketing team, and she's done demonstrations. She's come in and showed our therapists different ways to use the AlterG, which is really helpful, and she's actually come on a couple sales calls with me to help me present AlterG and market to the right physicians. So she's been outstanding, and she's always willing to talk to me. She continues to email me new case studies and sales tips, so I always use her. So when increasing physician referrals, really, you have to have a close relationship with the therapy staff and the director so that you can get together and find out which are the right patients, which works, who's working well with the AlterG, what they can do so that you know what physicians to market to and what patients will qualify for the machine. So different strategies that I use, Shannon taught me that on YouTube there's demos for every diagnosis I need to market to the right physician. So I save it on my phone, and then when I'm up on the floors in the hospitals, I can just pull it up and then show the physician. Once they start seeing the machine and seeing someone on it, they immediately ask questions, what it is, what it does, and then I can go into everything that the AlterG can do for a patient. Some of the physicians are a little skeptical, and for those that are, I try to invite them out for a tour. Some of them think it's separate billing when a patient comes in, and it's not. I think, Scott, you told me it's under their therapy. They bill it just as a therapy need, so it's not a separate billing, so I make sure that they understand that. Once I start getting out to the physicians and getting calls, I'll see if I can go into their groups and do a presentation, get them all the information they need, and then I start building that rapport with them. I deliver outcomes. When a patient is discharged from the facility that used the AlterG, I'll deliver those outcomes to the physician with a discharge summary. If I can get a testimonial from the patient, sometimes I don't get it for maybe a week after they're discharged back home. What I do is I send a letter out to their house with a self-addressed envelope asking them how their experience was, if they use the AlterG, how they feel. Some of them even might come back for outpatient therapy, which I'll share with the physician as well. Once the physician sees these outcomes, sees that it's working and that some of their patients are doing outpatient therapy, they start referring. I'll be in the hospital, I'll run into a physician, they'll say, hey, Carrie, did you get so-and-so? You know, I want to see if they can come out and try the AlterG. So that constant communication is what they're looking for. They're looking for those case studies, and they're looking for the progress of the patient and how well they're doing. Then I ask for the business on the floors while I'm there. Is there anyone you think that might talk to me about the AlterG, or anyone that you know that would benefit for their patients using the AlterG? When a physician, I really rarely, hardly run into a physician that doesn't see the value in the AlterG once they know what it is and they see it. That's why I always have it ready on my phone. So I try to invite them in for a tour to see if they can at least come in and try the AlterG for themselves to see what it does. When it's an orthopedic doctor, I let them know that it's backed up with the Ohio Orthopedic of Excellence, and testimonials of the patients that have had great success. And then I can discuss different treatment options and approaches that the therapists have used in the past for the patients using the AlterG. So really, when they start seeing the outcomes and they start seeing that name, AlterG, testimonials, they start to buy into it, and then they start to send their patients, even on an outpatient basis. They'll start sending them to the building to use this AlterG.
Okay, guys, I'm gonna jump back in here, and Carrie was just talking a little bit about how she shares our outcomes with the physicians. What we do to help out, I'll have my therapist, when they treat somebody, they've had good success. Even without the AlterG, we do this. If a patient doesn't happen to use it, a lot of them do, and when we have special success with it, I have the therapist write up kind of a blurb here about what they did, what their diagnosis was. This is one of my favorites because this was actually a patient that I treated myself here. Thomas came in. He progressed really slow at first. He was a perfect candidate for the AlterG. He had low endurance. He's never used oxygen before. First time in his life he's been on oxygen. He was really weak. He needed a lot of help to stand up at first. Once he started to get a little bit better, we wanted to put him in the AlterG. We explained to him what exactly it would do and how it would help him out, but he was very reluctant to do it, and you'll have people that are like that. He was simply just afraid to fall. Even though there's really no fall risk in it, your knees are never going to hit. You can lose your balance, your feet can go out from under you, but there's really no risk of injury there. So despite whatever we told him, he didn't want to get into it. We used a method we use with a lot of people, and I'll touch here in a few minutes on how to get people that are a little bit reluctant into the AlterG or just physically difficult to get in. With Thomas, he was a big guy. He had worked a labor job his whole life, but he was afraid to get in this. What we ended up doing was actually putting an elderly woman in it with a hip replacement into the AlterG. We ended up, she had great success with it. She was smiling during it. He saw how easy it was for her to get into it, and after that, he had no problem getting in it, and his progress skyrocketed after that. So after he saw it being demonstrated, he actually came down to, once he became more independent, and that's one of the things that's great with this, is with somebody who doesn't have any cognitive deficits, somebody who is around a modified independent level, they can come down on their own time too, as long as a tech is there to help them in. If anybody has rehab techs, they can help them to get in the AlterG, and they can spend their own time in that. Once they don't need our assistance anymore, and that really gives them an opportunity further their progress a lot. So as long as someone's there to monitor them. And this next one, Elmer, his main objective was to walk at his daughter's wedding. This was a great one for us, and we actually just saw him at a rehab reunion just recently. And to see these people walk in after coming in so debilitated, it really works wonders when the physicians see how far their patients went and they see what they're doing in the community afterwards. He was another one that was reluctant to get in it at first. But actually, I want to touch, too, a good thing to bring up to the physicians is that there is no fall risk, because when you're walking a patient, doing standing activities with them, there's always a fall risk. And that's one thing that everybody should know here. You absolutely don't want to send someone back to the hospital after a fall, after an incident at your facility. That happens enough, the physicians are going to stop referring to you. With the AlterG, if you're having them doing activities and they're walking in there and there's no fall risk, the physician should love that. The fact that their patients can come here and be safe and they won't be hurt at all, even though you can push them just as hard in the AlterG as you will anything else you're doing. This is our most recent one here. Mrs. Gearhart, really debilitated when she came in. She's the one that jumped right in. She didn't have any problem getting in. She wasn't fearful at all. She had a little bit more of a physical issue getting into it at first. What we had to do with her, because she was so weak, was we actually used, she was in the hospital for quite some time, so she wasn't an ortho patient or anything, but she really wanted to stand in it. We started off doing static standing in the AlterG with her, and I'm gonna go over a little bit a method of what we used to get her in it here in just a minute. But let me go over it. Carrie touched on this first a couple minutes ago. The AlterG is incorporated into your treatment plan just like anything else is. She said some physicians worry if there's a different billing code, how you're going to send it to the insurance, if it'll be covered. There's no specific goal needed for the AlterG. If they have ambulation goals, if they have homemaking goals, you can use the AlterG just as you use any other treatment plan. So there's no separate billing. It can be billed under a number of codes. You can bill it under Rehab, Theract, Therax. Standing in there doing, just for example, standing in there doing static standing but doing knee flexion in there, as opposed to active assisted range of motion. You take some weight off. It's similar to what active assisted range of motion is going to be, but they can do it completely on their own. And the fact that they can see themselves lifting their leg like that on their own with no assist, it really does work wonders for their confidence. So how to use the AlterG? When we're working with low-functioning or fearful patients, I mentioned Thomas earlier. You can demonstrate it for him. You can demonstrate it by getting in yourself. I would recommend if you have another patient that's able to get in it and have success in it, demonstrate it with another patient so they can see someone going through something similar. Sidestepping into it, not everyone might be able to step straight on getting into the AlterG. You do have a little step to get into the AlterG. So they do have some trouble with it sometimes, but incorporate sidestepping. A lot of people have to learn to sidestep in their kitchen, sidestepping to get into their bathroom. So you can incorporate some of that sidestepping getting into the AlterG. And a lot of times we'll end up having to use a tub transfer bench with a lower functioning patient. You set a tub transfer bench half inside the AlterG and half outside. Have them sit down. They can swing their legs over just like they would getting into a tub. We do this with some patients who sometimes they would be able to get in, but they're fearful of doing so. So we do it to help out, sometimes to overcome some fear, just to get them in that first time. And sometimes they really do have trouble stepping in there. Once they get in the AlterG, it's not a problem because we can take the weight off them. But to get in, sometimes they do need that help with the tub bench. But it's really simple to use to get them in there. Some of the exercises and some of the activities, this is something when Shannon came and talked to us, she came and talked to us about a year after we had gotten it. And it really opened up our eyes. It really helped us come up with new treatment ideas that we just weren't seeing that we could use with the AlterG before. Before Shannon came, we basically were just using it for ambulation, some static standing. I mentioned some of the stuff, it would be similar to active assisted range of motion we were doing. We were doing dynamic standing, having them stand the opposite. If we could turn them around backwards, have them stand, we can bounce a ball, we can tap a balloon back and forth and have them shift their trunk a little bit. We'll have them walk backwards. But some of the stuff she opened up our eyes to we didn't really think of before was if you have them in there but you keep the treadmill off, you can put targets in certain areas on the treadmill. You can have them lift their leg if they're regaining some of that strength after a stroke. If they can't quite lift their leg on their own outside the AlterG, but you take some of their weight off, they can lift that leg. They can control it, so they can regain some of that strength. They can regain some of the control in their leg that they can't do otherwise. So she's really opened it up, and I would really recommend having whoever's available in your area to help you out with the AlterG. They really can come out and help you open up your eyes. And some of the stuff that you're going to that she's going to tell you, it's definitely stuff that you want to tell the physician about, because these treatment ideas, obviously if we didn't think of them as therapists, the physician isn't going to know this kind of stuff that you're able to do with the AlterG if we don't relay it to them. So it's really helped Carrie. Since I've told her all these treatment ideas and she can refer them to the physician, I think it's really helped us get some more referrals in here and help people out.
One of the success marketing stories that I had just recently is I took this presentation to the cardiopulmonary rehab department at Akron General and incorporate it with our Cardiac 360 program that we have here. So a lot of cardiologists were getting in for patients that they just want to have lose weight so that they can get into surgery. Cardiovascular physicians are using it for their patients. And the director of cardiopulmonary rehab is actually coming out to the facility, one of our facilities, to actually trial this machine. And they do outpatient rehab after cabbages and MIs and surgeries like that. So he's actually going to be coming out and talking with us about the AlterG and maybe sending some patients our way, and we'll be bringing a cardiologist with him. A lot of COPD patients, too, I spoke with his staff, the pulmonary nurses and the cardiac nurses. If they don't qualify for going to their outpatient cardiopulmonary rehab, they can actually come here for inpatient or outpatient and use this AlterG just to trial it and see how it is. With patients that can't breathe very well, they get on it. Their body weight is the percentage is off.
Yeah, you can take, like Megan said a little bit ago, you can take up to 20% of the weight off. So as far as cardiovascular patients go, they can walk so much further than they would ever be able to. We've had people that walk the length of the parallel bars, not because they're weak, but because they get too out of breath. Once we get in the AlterG, we can, one great thing is, too, we can have them walk for a minute. If they get winded, if they get tired, we can have them stand and catch their breath. And then we can make the treadmill start to move again, and they can pick up. It's really a wonderful piece of equipment for cardio patients. Do you have anything else to add? All right, guys, we're going to go ahead and open it up to questions now.
Thanks, Carrie and Scott. If you have any questions, feel free to type into the chat box. We'll relay it back, and we'll be answering all questions right now. Anything else can be sent to us at marketing@alterg.com. So we'll see if any questions come in. A question that we did have earlier was, how did you track your patient outcomes and present them to physicians?
We track them once the patient comes in and admit. When we do the eval, we keep track it's the same software, but we have a software that keeps track of it. We input their current status when they come in the building, and then we put their status in upon discharge. We do that for every patient. So we've been keeping special track of the patients that use the AlterG. Once I get all that information, I can print out the chart, and when I print out the chart, I put together these success stories, and that's where Carrie takes over.
And when I'm in the hospital and I'm seeing the patients and I do feel that they might be appropriate for the AlterG, I will put it on my clinical notes and then email that to Scott in the therapy department to let him know that, hey, this patient is interested in trialing the AlterG, or this physician is wanting to know if this patient will qualify for the AlterG. And then that's how we kind of keep track of who's here, who's going to be on it. And then once that patient is discharged, that's why it's so important to have that good relationship with the therapy department so that you're all on the same page and that you all know what your target is and goal is to get these referrals.
Great, thank you. We had another question that was, how long has this product been in existence? So AlterG started in about 2005, and we have a few different models of our anti-gravity treadmill. The first model that was produced was our Pro 200. This one is built more for high-performance athletes. It goes 18 miles an hour forward, 10 miles an hour in reverse, as opposed to our medical model, which is this one, and this model was created in 2009. Okay, and then another question that we had was, how many therapists does it take to get a low-functioning patient into the anti-gravity treadmill?
If we have somebody there that uses the tub transfer bench, we have one person on each side of the AlterG, and then we'll have one person behind them usually. And usually those are for more heavy-set patients. It's really going to be hard. You're never going to have to use more than 3 people to help get someone in. If you do, they're probably not appropriate for it yet. We've had to use 3 people before, but that's really just for safety purposes. When the biggest danger is when they do have to stand up probably for about 30 seconds once they get up off the tub transfer bench, because there's going to be about 30 seconds where we have to keep them up and zip them up into the shorts, into the AlterG. There's bars on the side so they can hang on to, but usually with a really low functioning patient, it's going to take 3 people just to be safe. 2 probably physically assisting and 1 just to be safe in the back of them.
Great, thank you. Could you repeat again, either Carrie or Scott, what the most successful marketing tactics were that you've used?
I would say the success stories and the testimonials from the patients. And like I said, with the cardiopulmonary rehab director, was very interested in using this and incorporating it with the rehab at Akron General. So he is going to be coming out next week and bringing in his team and trying the AlterG out. So I think that's probably a huge success right there, because this is a huge hospital that's now Cleveland Clinic, and they're going to be working with us with this AlterG.
You know, one thing we actually did about a year ago that we forgot to bring up was we actually had an open house. We sent out invites to all the physicians in the area. There were chiropractors, cardio doctors, neuro doctors. We sent out invites to all of them for an open house to try out the AlterG. So we had several physicians actually come into the building to try out the AlterG to see what it was like before we really started marketing it more.
Great, thank you. Could you also tell us how much you use the anti-gravity treadmill each day?
Usually, we have, let me tell you how many people we have in our facility usually at any given time, so we can give you a good, so you can make a good comparison. Our building is a 150-bed building. At any given time, we'll usually have about 50 skilled people on, between 50, 55 skilled people on for the most part. We'll use the AlterG probably around 3 times a day on average. It does vary, especially if we have outpatients in, because usually we'll have 5 or 6 outpatients on and 3 of them are using the AlterG. So, but just within our facility, probably 4 times a day.
Great, thank you. We're getting in a few more questions here. Just a reminder to everyone, you can type them into the chat box right now, and we'll relay them back to Carrie and Scott. Have you seen your outpatient numbers increase since you've gotten the AlterG? If any of your patients who have left have come back specifically to use it?
Yeah, we've had several come back to use it. Our outpatient, in the last year since we've been marketing it more, we were consistently getting like 2 outpatients before. We're anywhere now, we haven't been under 5 in a long time. We're anywhere between like 5, 8, and 9 now. And we actually, I was just talking to someone in admissions. We have several coming in now, so we're actually about to be higher now in outpatient than we ever have before. Thomas, who I mentioned as a success story earlier, he came back and really the only thing he wanted to do was use the AlterG. So we've had several people come back outpatient that we've had stay here, and several of them have used the AlterG.
Thanks, Scott. Could you review again getting patients into the AlterG and the process of putting on the shorts as well?
Yeah. A lot of times we'll end up doing, OT will start off putting the shorts on. So we'll get the OT in or the CODA. We'll have the patient sit down. We'll try to have the patient put the shorts on themselves, but the shorts are really tight. So we'll have them do as much as they can. Getting the shorts on, it can be a struggle sometimes. Sometimes that's one of the patient's more fearful times. We got to have, if it's a low-functioning patient, we have to stand them up for a second and get the shorts on. I will tell you the shorts run a little bit small. So if you're questioning what size shorts to put on the patient, go a size up. But getting the shorts on is usually what we do with OT. Once the shorts come on, if it's a low-functioning patient, use 2 people to help them either sidestep onto the AlterG or put the tub transfer bench with 2 of the legs inside the AlterG and 2 out, just like you would do for a tub transfer. Sit the person down onto the tub transfer bench, swing their legs over, and then once they swing their legs over, have 2 people stand the person up. They have to stand on their own 2 feet for probably around 30 seconds because then you have to connect the zipper. There's a zipper on their compression shorts that they're wearing in the AlterG. So connect the zipper, zip them up. It's gonna, if you want to do it fast, you're going to want to have 2 people. Once the person becomes more independent, they can do all this themselves. But for someone who you don't want standing too awful long, use 2 people to zip them up really fast. Right away, you can hit start on there, and it's going to take the weight off of them right away. So it's going to lift them up to calibrate the weight once you start it, and then you can immediately start taking the weight off after that. So I know it seems like a difficult process, but it's not as difficult as it might sound.
And there's things on YouTube as well that you can plug in, difficult patient getting in the AlterG, and that's something I show the physicians too when they ask about the low level. It isn't very difficult.
There's a lot of steps to it, but they're not difficult steps. And I think Carrie's right. If you're struggling to understand what I'm saying, because I don't feel like I'm describing it perfectly, so get on YouTube and see how they zip some of these patients into it and everything. Hopefully that'll give you a better idea of what I'm saying, because I don't want you to think it's something that's really difficult to do to get these low-level patients in there, because it's really not. And
they've had a stroke patient that a wife herself helped him come in and get on it. Just her helping him, and he, it was that's a video I show a lot.
Thank you. Another question that we had, someone commented, sounds like this is a great tool. Do you see the carryover from what they do inside of the AlterG to outside?
Yeah, we do, and that actually reminded me of something. And I believe it was on one slide I saw, but I didn't say anything about it. There's a video monitor, and one of the biggest ways that we see positive carryover after they get out of the AlterG, and this takes several times for them to get used to, but someone who has an abnormal gait pattern, we can put the cameras at their feet, and they can actually watch their gait pattern. I know a lot of therapists probably know it's difficult sometimes to describe to somebody how to fix their gait pattern, and if somebody has an abnormal gait pattern, it hinders their progress. It can potentially be dangerous sometimes. So when they can actually watch their gait pattern on the monitor, it really helps them. That's one of the biggest ways that we see like positive carryover from in the AlterG and after the AlterG. Because people actually remember how they were stepping when it was so much easier for them, or how they were looking when they were watching their feet on the monitor. So we've seen a lot of positive carryover from that. And it takes a few sessions, but I mean, it's a lot quicker than trying to help describe someone their abnormal gait pattern. So we've seen a lot of successful carryover with that. Endurance-wise, we've seen actually really quick carryover after several sessions with the AlterG. I don't know if they're wondering about any specific type of diagnosis or anything, or specific type of patient that we've seen carryover with, but that's one of the best ways I can think of that we see, pretty quick carryover.
Thanks, great. And just so everyone knows, I sent out a link to our YouTube page through the chat box. Carrie and Scott have referenced this a lot, and they refer to a lot of our clinical videos that you can find on there as well. Scott, could you also review some of the non-ambulatory exercises that you've done with your patients?
Yeah. One of the more frequent ones we do is if you turn the patient so they're not facing the monitor, if you can put them in the AlterG backwards and zip them up and everything. If you don't turn on the treadmill, you do have to watch, because the treadmill will move if they have a retrograde lean or anything, because it doesn't lock in just like a normal treadmill doesn't. So you do have to watch that, just FYI. But if you put them in the AlterG backwards, you can do a ball bounce, you can do a balloon tap, we've had OT stand there and doing standing upper extremity exercises with a dowel rod, with a hand weight, TheraBand, and we don't have to worry about a fall risk or anything. So they're working on their endurance there, they're working on their upper extremity strength. With some of the lower extremity exercises, these are really great because you can compare them a lot to active assistive range of motion, but they're standing up, they can do hip abduction, they can do high knee lifts, they can do knee flexion exercises, and it really does wonders for their confidence because they're seeing themselves do this on their own. If you're normally doing active assistive range with them, it does a lot for their confidence, a lot for their progress so they can see themselves doing this on their own, lifting their own leg, doing these exercises. Also with neuro patients, and we've done this with ortho patients too, but with a lot of stroke recovery patients, if they're starting to regain some movement in their legs, what we'll have them do, we'll put a target, like we'll put tape on a certain area of the treadmill, a couple different areas on the treadmill. We'll have them lift their toe up, move it to that target on the treadmill. That way they're working on their strength, on lifting their leg up. They're working on controlling that leg again, which is a really difficult thing to do. So by taking that extra weight off, they can control, move to different areas on the treadmill. So that's a handful of the more common things that we do. They're also, if you face them backwards on the treadmill, it actually turns into like almost a flat table. So a lot of times if we're working on standing, on like static standing, we'll have them do several different activities standing up there on the tabletop. We can have them do anything from puzzles, we'll play cards. They can do a lot of different tabletop activities while standing in the AlterG because it turns into almost a completely flat table on the other side.
Those are all really great exercises. The next question that we have is, do you have any other body weight support devices, and how did you decide on the AlterG over another one?
We don't have any other ones. The only one that I'm really aware of, and the only one that I know that the other therapists in the department have talked about is a light gate. They've seen it work. I know that people have had good success with the light gate, but with the AlterG, one of the reasons that we ended up going with the AlterG was really just the technology in it. There's nothing else like it. The light gate is great, but it doesn't give the patients the amount of confidence that they get when they're walking with the AlterG. There's still something holding them up. They're still feeling like something's assisting them, like something's pulling them along. You still need people next to them the entire time. It doesn't give them the same feeling of walking on their own. It's more of a mechanical process, and it's just not the same type, truthfully, of marketing equipment as the AlterG is. As far as marketing goes, I can guarantee you'll have a lot more success with the AlterG than marketing with the light gate for really any of these types of patients that we've discussed. The way it works, the success that we've had, and the way the physician's going to see one of these versus the other, the AlterG versus the light gate, they're going to see it in a whole different manner.
Thank you, Scott. Okay, so I think that about wraps it up for all of our questions. If you have any other last questions, you can email it to us at marketing@AlterG. Thank you again, Scott and Carrie, for the webinar today. We'll be sending out this recording and the slides afterwards. And again, if you have any questions, feel free to email us at marketing@alterg.com. Thank you.